Hello everyone, I'm Dr. Shela Hirani, Associate Professor at the University of Regina, Faculty of Nursing, Canada. The title of my today's presentation is Workplace Breastfeeding Support Needs of Immigrant Mothers, Combining Breastfeeding with Employment, a Qualitative Study. Disclosures. I acknowledge that there is no actual or potential conflict of interest. First of all, background on the vulnerability of immigrant mothers. Immigrant mothers often experience trauma, family separation, migration from one country to another, and social disconnection in a new country. This vulnerability often has a negative impact on overall health and well-being of the immigrant mothers, as well as on their breastfeeding practices, mainly related to the social, emotional, psychological, and physical stressors while being in a new country. There are many challenging transitions of the immigrant families. When they arrive in a new country, they often present with the language difficulties. Mothers too often have the inadequate health insurance coverage and lack of access to the healthcare services, especially they have the inadequate breastfeeding supports while being in a new country. At times, they are unable to pay for the lactation consultant fees while being in a new country due to financial hardships. Each year, Canada welcomes large number of immigrant families with the young children. Saskatchewan has a noticeable increase in the immigrant families with the young children. Most of the immigrant families migrating to Saskatchewan, which is one of the growing provinces in Canada, they are coming from the various parts of the world, including Asia, South Asia, Africa, Europe, Middle East, Central Asia, and South America. This province also has a noticeable increase in the immigrant population who are employed and have the young children. This suggests that the lots of needs are there for the immigrant mother that needs to be taken care of, especially for those who are employed and with their young children. There are several knowledge gaps based on which we undertook this study. There were significant knowledge gaps in the knowledge surrounding that what are the breastfeeding support needs of the immigrant mothers who combine breastfeeding with employment. And it was essential to explore the breastfeeding and workplace-related challenges of the vulnerable group of the immigrant mothers to better respond to their challenges and initiate the need-based baby-friendly initiatives in the workplace settings. The aim of this study was to explore the breastfeeding barriers and workplace breastfeeding support needs of the immigrant mothers who combine breastfeeding with employment in Saskatchewan, Canada. We used the qualitative descriptive study design in order to identify the range of the breastfeeding barriers and related breastfeeding workplace support needs of the immigrant mothers who combine the breastfeeding with employment and would like to sustain their breastfeeding practices. The study was undertaken in Saskatchewan, and we recruited the participants from the different cities in Saskatchewan, as well as from the different urban and semi-urban areas. The data was collected using multiple methods, including the in-depth interviews with the immigrant mothers. We also undertook the field observations, especially we observed the workplace settings to identify if they have any breastfeeding rooms available or private spots where mothers can breastfeed their babies. We also undertook the document analysis to review the policies on the maternity leave, parental leave, and to identify whether the workplace settings in Canada, especially Saskatchewan, do hold any breastfeeding policy for the mothers. We undertook the in-depth interviews with the 30 immigrant mothers from the diverse cultural groups and those who were having the children aged 1 day to 24 months of the age. We acknowledge the support received from Saskatchewan Health Research Foundation that funded this study. We are also thankful to our collaborator, United Way Regina, Saskatchewan Health Authority, Regina Open Door Society, and Saskatoon Open Door Society that assisted us in participant recruitment and knowledge dissemination. Now the findings. The very important theme from this study was on the financial instability. Many immigrant mothers spoke on the challenges while being in this new country. They shared that in this new country, they have to look for the number of factors in order to survive, especially paying the bills and paying for their mortgages or their rent, and also for the cost of vehicle and recreation for their children. So as a whole, they are really having lots and lots of the financial needs. And on the contrary, it's so difficult to find a job in this new country for them. And again, they mentioned that they at times, based on their financial needs, have to join the employment soon after their childbirth. And as soon as they resume the work soon after their childbirth, they are unable to sustain their breastfeeding practices because their whole attention is on meeting the financial needs of their families. Immigrant mothers further mentioned and spoke highly on their ineligibility for their maternity and their parental leaves. Many immigrant mothers in our study mentioned that it was so difficult for them to find the full-time job, and ultimately they are resuming the part-time or the casual level of their employment where there are no benefits for them, especially the maternity and the parental leaves, because for become eligible to be availing the maternity and parental leave, they should work minimum 90 days with the same employers. But unfortunately, our mothers were working in multiple jobs on the casual basis and with the different employers, and they were not meeting this target of minimum 90 days with the same employer. So as a result of which, they were not having those benefits and leaves option available. For many mothers, those leaves were not fully paid leaves, so they were in the concern that to be able to meet the financial needs of their families, they were choosing to resume their employment, no matter it is part-time or casual basis. And also mothers spoke about that when there were no leaves, they were not able to devote the very good quality time with their babies and sustain their breastfeeding practices. They also shared that there are long wait times in filing for the maternity and parental leaves, and at times they are not very much aware of that what are some of the benefits that they can apply for. There are some income supports available for the new families, but those are quite limited. And many immigrant families were not actually very well aware of the whole process of the application for those income level support, and that was another level of the barriers. Many mothers who were facing the financial hardships also shared that they were not eating a quality food because the quality food or the purchase of those items were very costly, and they were not able to afford them. So they were eating less and feeling more fatigued with the work and breastfeeding. Also, mothers spoke on the limited support within workplace. And when we identified that what are some of the areas of the support that they are really looking forward to, they mentioned that they are looking forward for the emotional, tangible, emotional, and psychological support in general as their definition of support. But unfortunately, those supports were not available in the workplace settings from their employers, from their co-workers, and from the organization in general. And not many people were understanding what the needs of a breastfeeding mothers are. And that's how they were not getting the enough time to breastfeed or the enough flexibility to go ahead with their breastfeeding practices. Mothers also shared that they had a limited social support outside their workplace settings. They spoke highly that many of them do not have the partner or spousal support, as a result of which They are really like juggling with the multiple responsibilities while being at home, while simultaneously working and breastfeeding their babies. They also shared that in the home country, they had a very good support from their extended family members. But while being in a new country, they have a limited friends, and even neighbors are not very much in contact with them. So they are not able to avail much of the support from them. They also shared that even the daycare center staff do not share them anything on the breastfeeding or support them very highly on sustaining their breastfeeding practices. Even they shared that the support that they receive from the healthcare providers are quite limited, especially they don't have a free of cost breastfeeding counseling facilities that are readily available for them. And even they shared that they have, as a whole, the limited community and government-based support that can support their breastfeeding practices. Mothers in our study who were working in the different service industries, and they were nurses, they were working as a teacher, they were working as an office assistant, or they were working in the restaurant in different capacity. They shared that in their workplace setting, there is no time to breastfeed. And they mentioned about that they many times they are not able to pump their breast milk every 2 hours, as a result of which they end up into the breast engorgement. And by the time they reach home, the breast engorgement is so painful and severe that they are really facing much add-on challenges to sustain their breastfeeding practices. And with the breast engorgement, feeding the baby is much difficult and need the extra support in terms of emptying the breast on time. So mothers also shared that they have a very limited flexibility at their workplace settings based on the nature of work. It also serves as an add-on barrier towards their breastfeeding practices. Mothers in our study also spoke highly on the inadequate, culturally sensitive breastfeeding accommodations. They shared that in their workplace setting, there is no privacy and no breastfeeding rooms where they can breastfeed their babies if the babies are with them, or like they can even not pump their breast milk using those private spaces because there are none available in their workplace settings. So mothers often have to use the washrooms to express their breast milk. And that makes them much more depressed because in the washroom, whatever they express and they store, so the breast milk is no more that much clean, and they are not very comfortable in feeding their babies the breast milk that was expressed in washroom. And while there is no space for storage of those expressed breast milk, even they are able to express it in any ways. And that's what the add-on challenges for the working mothers were in the workplace settings in Saskatchewan. Mothers further shared that there is no baby-friendly initiatives in the workplace settings, especially there are no supportive policies, and there are non-availability of the lactation support programs whereby they can feel more secure to seek the support, to seek the workplace flexibility and request for the support of their employers in giving them the breastfeeding breaks. So that was another layer of the complexity in the workplace settings where immigrant mothers were working. Mothers further highlighted that there is a racism in their workplace settings, and it's not only in their workplace settings, but also they face the similar kind of the situation in the healthcare setting and society at large because of their cultural differences and because of their limited English language proficiency and then their way of dressing. Many mothers mentioned that because of the racism, they are like viewed differently and they are not being offered the need-based, culturally appropriate respect and support in their workplace settings. So overall, based on the barriers that mothers shared, they also had the various recommendations that what should be available. So every mother in our study spoke highly on the availability of the need to have a workplace support, and they shared that there should be the workplace settings where there are the baby-friendly programs available, and the whole workplace setting is so baby-friendly, where their breastfeeding needs are being well taken care of and are being supported. They also recommend it for the workplace settings where there is no racism. There are supports available from the employers and colleagues. There are private spaces to breastfeed. There is enough flexibility for them to breastfeed their babies or express their breast milk, and there is enough time to breastfeed while being in their working hours. So after those participant recommendations, here are a few recommendations from our research team, and we highly recommend for the breastfeeding practices for the immigrant mothers, and we recommend that those breastfeeding mothers should be supported. They should be offered the social support, the workplace support. There should be the breastfeeding policy in the workplace. There should be the job flexibility, as well as there should be the availability of the culturally sensitive breastfeeding spaces where mothers can either breastfeed or express their breast milk. Another recommendation is that the workplace lactation support program should be there in all workplace setups to promote, protect, and support the breastfeeding practices of all mothers, including the immigrant mothers in Saskatchewan, Canada. Also, our recommendation is that it is essential to involve the immigrant mothers as a partner in designing the innovative and need-based workplace programs that can facilitate them in combining the breastfeeding with employment. And here I would like to highlight that many times there are programs that are designed for the specific target group, but the program can only be successful when we are really involving the target population as a partner, because they are the one who can suggest that what are their needs and what should be the next steps to better help them out. So it's really important to involve them as a partner in designing the programs, policy, and practices. Also, another recommendation is that the workplace settings must have a zero tolerance policy for the racism, and the principles of equity, diversity, and inclusion must be followed in all workplace settings. Another recommendation is that there should be the partnerships and collaboration among the interdisciplinary professionals, governmental and non-governmental organizations for the successful implementation of the workplace lactation support programs in all workplaces. So here, it's not only the workplace supervisor who are responsible for any initiatives that can benefit the immigrant mothers in general, but it's also the responsibility of the government, all the multidisciplinary and interdisciplinary professionals to join hands and along with the patient partners, especially involving the immigrant mother as a partner in the team, and then designing and co-designing the need-based interventions and executing those interventions in the workplace would really make a big difference. So here is the knowledge translation videos link that we designed from this project. If you would like to watch it, kindly follow this link and you would be able to view the whole animated video that we designed from this project. You're most welcome to pass this link to your colleagues and students. Here are a few publications of mine related to this topic. If you are interested in accessing the full text articles, you are most welcome to reach out to me with your request. Here are the references that I use in today's presentation. Here are my contact details. If you have any question with regard to my today's presentation, you are most welcome to reach out to me. Thank you so much for your attentive listening.